Dental Associates joins us now, and he's ready to take your phone calls. The number's right here on your screen, 1-877-924-7888. How are you doing, doctor?
I'm doing fantastic.
As always, you brought some props?
I brought a case here, yeah, and I want you, if you can look at this one first, you can see that she's got spaces between her teeth. Now, the key to diagnosing a case like this is that also some of the gum tissue is over top of the edge of the tooth. So it took a combination of recontouring the teeth, and then I'm going to show you the after here alongside of that. So there's the before and after. Yeah, she did have her hair up on one and down on the other, but just a huge difference it made with her appearance, and she was just so tickled with it. But what we had to do is actually recontour the tissue with a laser in order to be able to do that.
This is veneer, right?
These are veneers, that's correct. And, you know, it's a great process, especially because you don't have to generally affect the teeth at all. You don't have to cut down the teeth in order to do a case like this. You're basically adding to the tooth structure. And they are made out of ceramic, and ceramic is a very durable material. A lot of the ones that I did years and years and years ago, I told people, well, you know, maybe it'll last 10, 15 years. And I've had ones that have been on there 20, 25 years and still holding up. So you never can tell for sure. You have to check a lot of things, and people have to take proper care of them in order to maintain them that long. But it's very, very durable restoration, as opposed to the other bonding, and that's a plastic material, and bonding does have a tendency to chip and stain and change color over time. So
this is a better option, in
I
your
think
opinion.
so. It is. It really is.
All right. I think we have our first caller. Sherry's on the phone. Hi.
How can we help you, Sherry?
Yes, I was wondering if you know why I would have, like, thrush and dry mouth all the time.
Well, that's a yeast infection is what that is, and of course it has to do with the balance of the bacteria and the yeast and whatnot that live in your mouth. So certainly there's a correct treatment for that, and once you do that, then it's a matter of keeping your mouth really clean, maintaining it, eating a well-balanced diet so that it doesn't have a tendency to reoccur. We notice that sometimes diabetes have a tendency to have thrush too.
Our next caller is Sharon.
Sharon.
Hello?
How can we help you?
I was calling. I've heard for years that if you have radiation done, and you know, if you have cancer and have radiation, you can never have your teeth worked on again. Is that true?
Well, a lot of times what happens with radiation from cancer treatment, you lose a lot of the salivary flow, and so what happens is people tend to lose teeth due to decay and other problems because of not having saliva. Saliva is key important to healthy teeth. So a lot of times they'll have teeth taken out that are in the path of the radiation. So it does compromise the bone growth and the bone around the area, and generally it does eliminate the possibility of implants a lot of times when you've had radiation to your jaw. But look at it this way. You got the treatment for the cancer, and obviously that was successful for you, and that's a real blessing. So, you know, the key is, of course, great diets and, you know, exercising and keeping yourself healthy helps reduce your chances of cancer, and antioxidants play an important role in that. How about Kathy? What's your question?
My question is, sometimes the teeth begin to shift and you have spaces. About that.
Well, this case that I just showed is a perfect example of that, but you do want to get to the root cause of why the teeth are spacing. Generally, it's the loss of back teeth that then cause the front teeth to open up and spread apart. So you want to solve the problem of stability in the back teeth first before you fix the front teeth. Otherwise, the space is liable to open right back up again. So look at the whole picture and make sure that they're diagnosed in the entire treatment. I want to mention our implant seminar is coming up, and it is on the 4th of May, which is a week from today, and there are some positions available. People have been raving about these seminars. They say that they really get the information that they need, and a lot of these patients then select treatment to be done based on their learning things they found out at the seminar. So please join us.
You've had a pretty good turnout for those too.
We have. It's been a great thing, and people really enjoy coming to a non-threatening environment where they can just ask questions and learn more about it.
All right.
Because education's the key. That's why we're here today.
It's true. All right, Dr. Sim, thanks so much for stopping by.